Hi everyone and welcome back to our second Q&A session. I'm back again with Karolina and today we're going to be discussing dry needling. So Karolina, what is dry needling?
Okay, so dry needling is a way of using a little acupuncture needle to basically release muscle tension and also to take pain away or to manage muscle pain.
What does dry needling feel like?
So the needle itself is very thin. It's almost as thin as a strand of hair. So when the needle goes in, most of the time people don't feel much, or they might feel like a little skin prick as the needle goes through the skin. It's called a dry needle because we're not actually injecting anything, and usually there's no bleeding either. So basically it goes straight into the area that is a bit like, when I touch it, it feels tight and it will feel tender for the person. We call that a trigger point, so a tight band of painful muscle. And we put the needle into that area. The muscle then usually twitches or spasms and then it relaxes. Or you might also experience a little bit of like an ache in the area, kind of like when someone pushes on a tight sore muscle, and occasionally you might feel like a little zapping or a referral of pain away from the area that the needle is inserted. But we only leave the needle in for like a second or two, and then the pain usually goes away really quickly.
Okay, so is dry needling safe for everyone?
Well, there are certain people where needling is not an option for them. So if you're on blood thinners, or if you have some sort of an infection or low immune system, or like a skin rash or broken skin, we would avoid doing a needle there. Also, first trimester of pregnancy, it's advisable not to have dry needling for that. But otherwise, I mean, as physios, we are primary care practitioners, which means you might see us first for something like this, rather than a doctor. So we know how to screen for it and check all your medical history to make sure you're safe.
Okay, so are there any side effects to dry needling?
Yes, so basically there is the possibility that you might bleed a little bit or have a little bruise, but that is usually fine and it goes away in 2 weeks. It's just like knocking yourself against a door frame and getting a bruise there. But most of the time I find I don't cause too much bruising, but it can happen. Look, you can be a little tender afterwards, so I do tell people, at least for 2 hours, if not 24 hours, the muscle that I've needled might just feel a little bit tender, a little bit bruised, but generally you still feel better than what you came in. It just sort of feels like the muscles had a bit of a workout.
Okay. Post-treatment, would you recommend anything for clients?
Yes, so I strongly recommend putting a heat pack on as soon as you can after you dry needles, if you can. We have stick-on heat packs if people don't have a heat pack to get to because they have to go to work, for example, but basically heat is the best thing. It's also sometimes a good thing to strap the area. For example, if you've needled around the shoulder, you could strap the shoulder in a nice position just to hold it. But mainly the heat pack, and I can also show the person some nice stretches. So it's all about getting that muscle to completely relax.
Okay, lovely.
Yeah.
We're now going to have a demonstration of dry needling, so if you are squeamish to needles, we recommend you look away now.
Okay. Okay, so I'm going to show you how I dry needle, and for Sarah, she's having some restriction in her shoulder, so we're going to be needling at the back of her shoulder to help her get more movement back. So Sarah, show me how far you can lift that left arm.
So just about there.
Yeah, and what are you feeling?
Stiffness, and it's a little bit sore as well.
Okay, no worries. So we'll get you lying on your tummy. Normally I would have done more assessment of the shoulder, but just for the purpose of today, I'm going to show you the treatment. So I would have already determined that Sarah has some trigger points, so tight, sore areas of muscle at the back of her shoulder. So I've got my needle, a sterile single-use needle, and I've got a little alcohol wipe. So I'll just start off, and I have washed my hands, so I'm just going to start off by just having a feel around her shoulder. And I'm going to ask Sarah, does that feel tender there?
Yeah, a little bit.
Yeah, and I can feel that that is a tight band of muscle. So what I do once I've found that is I just wipe the area with an alcohol wipe. So it's all nice and clean and sterile. And then I open up the fresh needle packet. And then from here, I find that area there again, and I just line my needle up. I do a little tap on the needle, and then I don't touch the needle, I just push it through with the little plastic bit at the end. What do you feel there, Sarah?
Yeah, I can feel it in there.
Just a little bit achy?
Yeah.
Yeah, but you're okay?
Yeah.
And then I'm just going to take that out, and no blood, no bruise. So Sarah, if you're okay, can you sit up for me?
Yeah.
Good. And then just show me how far you are able to lift your shoulder now. Oh, wow.
Yeah, a lot better.
Feels better?
Yeah.
Cool.
Thank you.
All right. And as I say to everyone, just put a hip pack on after that if it bothers you, if the achiness bothers you.
Yeah.
Otherwise, I will show you some great stretches and exercise to make sure your shoulder doesn't get tight again.
Perfect.